Members of the Health Allied Workers Union, a trade union, are marching from the SABC offices in Polokwane to the Department of Health today. The union demands the department fill vacant vacancies, including the appointment of 82 community service doctors. SABC News reporter Katlego Nyoni is joining us now live. Katlego, good morning and thank you so much for making time for us. Tell us about today's march.
Well, scores of workers affiliated to the Health and Allied Workers Trade Indaba Union are expected to today hand over a memorandum of their grievances to the Department of Health in the Limpopo province. Now, these workers are concerned over what they say is the non-absorption of nurses as well as other workers in the health department. They say that there's about 1,200 posts that are vacant, and the Department of Health has not so far absorbed these workers, and that the Department of Health also terminated contracts of about 706 nurses. Now, they're expected to hand over their memorandum of grievances to the health department. The Department of Health also has been under the spotlight lately for several allegations, also for the non-absorption of community service workers as well as doctors. I'm going to speak to the Haiti representative this morning, that is Gabriel Matlo. Gabriel, thank you very much for joining us on SABC News. Just take us through what your main grievances are as a union, as Haiti.
Okay, as Haiti, we are saddened by the termination of our contract of nurses. So our demand here, we are just submitting the memorandum requesting that all the nurses must be absorbed and all the vacant posts should be filled in the health department.
The Department of Health maintains that it has absorbed some nurses as well as community service doctors as well as contract workers from COVID-19, and that this is handled by the national department. Is there anything that as a union are you going to that's included rather in your memorandum?
Okay, I can say there are vacant posts, so we want those posts to be filled. All the vacant posts in the health, we want them to be filled. So our memorandum is just to say hire all the nurses, hire all the allied. We are here to represent workers who are not working. We are here to fight against unemployment.
All right, what else is your key concern as a union, as Haiti?
Okay, we are looking forward to fight for the suitable working conditions for all the workers. And we are demanding that the clinics should operate 24 hours. That could only happen if health and allied workers are hired and they are hired permanently.
Thank you very much, Gabriel. That's Gabriel Matlo from Haiti, the union that will be handing over their memorandum today to the health department in the Limpopo province. I'm now going to speak to a contract worker from COVID-19, that is Stefina Masengi, who is an Stefina, very good morning. Thank you for talking to us on SABC News. You are a contract worker, and what are your demands? Are they similar to what Haiti is saying? Is Haiti speaking on your behalf as well?
Yes, they are speaking on our behalf. And we also have our grievance. Today we are going to the Department of Health, where we're going to hand over our memorandum as our contract came to the end on the 30th of June. No one has told us our contracts are finished. And then Dr. Poppy Ramatoba promised us that after the contract were finished, we're going to be absorbed. We are not absorbed. We want absorption. We don't want contracts anymore. We want absorption with immediate effect, because we were heroes on COVID-19. Now we are dumped like a used syringe. So we demand us to be put on the permanent post as with immediate effect, because the community is the one that is suffering right now. At the hospital, people are working understaffed, and then there is also lots of incident at the hospital because people are working understaffed. I'm working in ICU, but I'm working, you're supposed to find that in the ICU there is no RNs like me that is working and experience. We find that there is ENs that are working with the ICU patients. So now they're telling us there is no money in the treasury. There is a money. Treasury have the money that budget came nationally. We must be absorbed as promised. We demand it. It must be done.
Thank you very much, Stefina. Ndatoka, I can see you agreeing with what Ms. Stefina is saying. Is it also similar demands? Have you been unemployed and are you seeking to be reabsorbed by the Department of Health?
Yes, exactly. Yeah, even me, I'm one of COVID-19 contract workers, and then we are so hard ripped by the decision that Department of Health take against us, because as the COVID-19 contract workers, we've been failed.
Have your contracts been renewed or not?
Currently, not yet. We didn't hear anything from Department of Health.
So, how long have you been unemployed for?
Actually, our contract ended on the 30th, on the 30th June. So, and then since June until now, we didn't hear anything. So, actually now, we don't want the contracts anymore. What we want the absorption. Because we are aware that in that department, there are funded vacant posts. And those posts are the jobs that we are doing currently. The nurses that are captures, porters, all I can mention them. So we want the MEC and all his cabinets to absorb us before they can advertise those posts for the people, those who or their friends or their children or cousins, whatever. We want the MEC and all the decision makers to take us to fill this position because we are worthy. There is no way they can take people from outside to fill this vacancy while we are there. Because we risked our life during the COVID-19. We risked while everyone was hiding. We were forefront, we were heroes. But now because the COVID-19 has passed, so they want to take their friends and their relatives to fill this. No, and we are not going to allow this. We are going to fight with everything that we have until we make sure that department share what we are seeking for.
Thank you very much. So these are some of the members affiliated to Haiti, which is expected this morning to hand over their memorandum of grievances to the Department of Health in the province. Now, these workers and these employees say they were provided contracts during the COVID-19 pandemic, and that they worked during that pandemic as nurses, and that they are now demanding reabsorption by the Department of Health. They are now expected to deliver that memorandum of their grievances before midday to the Department of Health in the Limpopo province. With that, it's back to you in the studio.